Good morning, everyone. Looks like we have the team up. Who's going to lead us off?
Well, I will get us started. Good morning, Marilyn Mann, Health and Human Services. I hope this finds everyone having had a great, restful 3-day weekend. We're going to be providing an update to your board about our vaccine clinics and vaccination planning. And we did have, as you may be aware, last week, a rather heavy adding of numbers that brought us up to 924 cases and 29 deaths as of Friday. We had a little bit of a slowdown over the following 3 days and are likely to be reporting somewhere around 46 today, but that is over a 3-day period. So that is good news. We are still in zero capacity in our region for ICU beds, and we continue to track in the purple. So as a reminder to the public, I know that we have had questions about why we're showing as a purple county and we're more restrictive than the purple tier. Because of our regional stay-at-home order, that has sort of trumped the tiered system. So we remain in the regional stay-at-home order, which is very restrictive, but we are tracking in purple so that when that order is lifted, we would more likely than not be going back into the purple tier and resuming the tier status. So I just want to take an opportunity to clarify that for the public. And there's a lot going on in vaccines and still have limited supplies, and want to assure the public and your board that our vaccine clinics in partnership with our northern and southern Inyo hospital systems have been running, and we have been vaccinating. And I think Anna is going to provide a bigger, broader view of that, of where we're at. So Anna.
Yes, good morning. As far as vaccine distribution goes, we've seen a lot of activity over the past couple of weeks in starting to build out some more availability, both within public health and amongst our providers. I do want to temper that with the fact that we continue to have a fairly limited amount of vaccine coming in each week, and we expect that over the next week or so, still monitoring that very closely as the state awaits additional vaccine distribution from the federal government, but still seeing, even as of this week, that the allocations statewide are lower than lower than demand, certainly, and lower than we were expecting based on some of the announcements that we heard last week. So we were actually allocated 100 doses for this week, 100 new doses, which is not enough, obviously, to meet the demand that we have within our communities. So we've been working very closely to partner with Northern Inyo Hospital and Southern Inyo Hospital to start to do distribution through their rural health clinics to be able to address as we move. Well, we continue to do our 1A population, but we're towards the tail end of that, but starting to move into the 1B population, which as of last week was expanded to include everybody over the age of 65. Continues to also prioritize a couple of other particular industries, including teachers and childcare providers, non-medical emergency responders, and food and agricultural workers who are directly exposed based on their jobs. So as we have very limited supply, we've tried to be very thoughtful about how we address all of those populations at once, and are really focusing through our rural health clinics on the older adult population. We know that that is where we see with a more severe disease, where we're seeing more of our hospitalizations and ultimately more of the deaths from our community members. That's true here as well as throughout the rest of the country. So very much want to be able to, as that vaccine starts to flow, prioritize our older adult population, while also recognizing that we have many specific individuals within our communities who are also at high risk because of their occupational exposures, and continuing to address those as well as equitably as possible. So I just want to step back and give you an overview of our vaccine distribution to date. We are seeing nationally a lot of reports about the fact that vaccine rollout has happened slower than anticipated, that distribution seems to be slower than we'd like to see it within California. Have been on several calls over the last week and through the weekend with the state, trying to identify what exactly is happening around that. I can say for Inyo County, our distribution is not contributing to that problem, but we are eager to help identify what those issues may be statewide, to be able to reflect what actually the administration rates are throughout the state. It does seem that there are some data issues compounding that distribution. And so we're really taking a close look at the state level at the immunization registry and any kind of delays in getting vaccine that's been administered into that registry. That's obviously used to help us benchmark where we're at, how much vaccine's been delivered. So there's a lot of activity happening right now to make sure that our data systems are working properly, and that that as those shots are getting into arms, we're able to account for that, to be able to show, not only know internally for planning purposes, but certainly to reassure the public that as that vaccine comes in, that it's going out. So
if I could add on that, Anna, just from the statewide groups that I'm on, it's definitely a data issue. That most counties are getting the vaccine into people's arms as soon as they get it. The big limiting factor is the amount of vaccine. And the reason that it's so important for the state to fix this reporting issue is the federal government is going to be allocating the vaccines to states, not on a per capita basis, but on when you get that, when they've used up the vaccine that they've already gotten. So hopefully the state fixes their reporting system, because just from talking with all of my other colleagues around the state, that they're in the same situation that we are, that, as soon as the vaccines come in, we get them administered to folks, and we need to get that reporting errors fixed so that we can get additional doses.
Yes, thank you for that. Huge focus on making sure that all of the data is getting entered properly, and that it's moving into the system and captured accordingly. So I do want to just step back and give you a little bit of information about where Inyo County stands right now with vaccine distribution. So through today, we've received a total of 2,130 doses for Inyo County. Of those, 1,415 are first doses and 715 are second doses. So we started, especially initially at Northern Inyo Hospital, with our very first allocation of vaccine in mid-December, started administering that to our healthcare workers, and have, as of about a little over a week ago, started doing those second round doses with Pfizer. It's 21 days later. So we've already jumped into doing second doses for the Moderna vaccine that we've been allocated to through our public health department, as well as Southern Inyo Hospital. We'll start doing second doses next week. It's a little bit wider time frame for second doses, 28 days for the Moderna. So we're going to be starting to get into second doses in higher volume next week. So far, we have administered about a little over 1,000 doses of first dose vaccine. So we're right around 70% of those first doses being administered. We have, through the clinics that are set up at both rural health clinics in Northern Inyo Hospital and Southern Inyo Hospital, as well as the clinics that we have set up through public health, we will get entirely through that allocation of first dose vaccine this week. We've scheduled out, we should administer all of those doses or close to all of those doses by Friday. Second doses, we've gotten about 56% way through all of those second doses. So most of that has been second dose Pfizer. And that percentage is largely dependent on scheduling. We don't administer those until it's time. So we're a little bit farther behind from a percentage standpoint, but completely on track and on time with that second dose schedule. So we're seeing really good acceptance of the vaccine amongst the priority populations. We're not experiencing what I've seen reported in some other parts of the state or country where healthcare providers, for example, are declining at a higher rate than we expected. We're seeing a very consistent acceptance of the vaccine, a lot of demand for the vaccine in Inyo County, and really having no trouble finding the people to deliver that vaccine to. As we start to see those allocations increase, we very much hope that in the next couple of weeks, we start to see those allocations flow into California and down to the counties. We are working on plans for larger distribution, mass vaccination clinics. That largely is dependent on having the vaccine available, but actively working on the plans to get those larger clinics going so we can do more people at once, have a very robust flow of individuals going through those mass vaccination clinics and be able to stand those up hopefully in February, or at least start. We do expect that at that point in time, we'll continue to be working with either the Pfizer or the Moderna vaccine, which will still have that second dose requirement. So that in and of itself will somewhat slow our ability to do clinic, because we'll always have that second dose clinic to have to catch up on. So we're really trying to be thoughtful about getting things scheduled, getting them staffed, making sure we're ready to go. So as soon as we have that vaccine, we can start to get it out in larger quantities. But as of right now, are really working to make sure that as the amounts that are allocated to us come down, that we're distributing those out to our rural health clinics. We're working also on getting Vaughn's is up and ready to receive vaccines. So we will be working on next steps for getting additional vaccine out through that pharmacy. And then we also have some additional staff who are working to reach out to other providers who are eligible to receive vaccine to make sure they get through the enrollment process, have all of the reporting, access to the reporting that's required, and are able to add additional providers as well within our communities.
And I have a question and a little bit of a comment first, and that is I want to thank you for setting up that registration program. In my opinion, the phone call this number does not work. I know we maxed out the hospital on those calls. People were getting confused as to which number to call to get online. So I guess the only question I have is are we coordinating that registration? I've had people call me and say, okay, I did what the county said. I went and registered, but now do I still have to get online to the other number or register someplace else or call Vaughn's or call the hospital? So that's the question.
Yeah, thank you for that question. It is confusing, and we all saw very clearly last week as that telephone number, the dedicated telephone number stood up at Northern Inyo Hospital, had huge call volumes. Also at the same time, just just came out right after we had put up our vaccine website for Inyo County and started to take registrations in that way as well. So to answer your question, we are coordinating with both hospitals. So as people register into that county form, we are sending that down. Now, both hospitals also are maintaining their list. They're looking at their, not just their own patient population, but that is the data that they have, looking at who they have, who meets the criteria for the over 65 and over, to make sure that they're reaching out to those populations, and then also taking in through either telephone calls, which have been difficult to get through because we have just added, when we expanded to the over 65 population, that increased by several thousand the number of people who are now eligible to receive vaccines. So volume is high. Bottom line is that when we're taking that information through our website at the county, we are able to share that down to the hospitals and ultimately other providers that are providing vaccine in the community, so that we can help get that information over and get people scheduled for vaccine as it becomes available.
And may I ask a question? I want to zero in on what Supervisor Pucci asked. This is something that's come up to me. You kind of started on addressing it right there. So the form that you fill out is great. And now we get, people get responses back. So they get the response. So that's great. I think the confusion might be, and maybe you could just address that so that people hear it. So then what do I do? So am I told to, where am I told to go? Because some people are assuming that maybe they would go to one of the pharmacies. Some people are assuming they'd go to the hospital. Maybe if they live in Independence or Big Pine, they don't know where they go. So would those providers, after you've spread that information across or broadcast, would those providers then pick who they're going to then reach out to, and they would do the connecting? Is that how that works?
Yeah, that's how it's working right now, where we take the list, and then there, as appointments become available, people are getting contacted to schedule. Now, because we want to make it, not everybody has internet access. Also, people can call to try to get an appointment, but right now there's just, the volume is so high. Really getting registered onto that list, I think, is the most effective and what I would recommend that people do. We have had a couple of individuals who've contacted us who don't have, don't use the internet, don't have email addresses, which restricts the use of the form. And so we, what we've done with those ones is recommend that they use, there's a dedicated Inyo County email address right now, vaccineinfo@inyocounty.us, where we're taking the questions that are coming in. So we're using that as kind of a generic email address to help people get onto that web form if they don't otherwise have an email address. So we're trying to work through some of, we're trying to utilize our technology, but also not exclude people who aren't comfortable using it. So in some cases, people are more comfortable, especially if they're already established with a doctor at one of the rural health clinics, in just calling directly over there. So I don't want to discourage that. But really, I think because the volume is so large, and to be able to have a consolidated list, it's, for those who have access to that web form, I think that's the best route to go right now.
And I would just add that you can access the county website. There is a quick link bar that comes up, and it says vaccine information. I'll take you right to that page, and on the right sidebar where it says ask a question, that you can type in there, and you'll be able to access the county email for vaccine information directly that way. If someone is struggling because they don't have access to the technology, we hope to have a vaccine hotline through the county also up and running shortly. And we might, help, it will help. But again, the volume of calls has been so tremendous. I think last week on one day, the rural health clinic's phone line had received 10,000 calls. many of those were probably repeat calls because people are having such difficulty. The best way to access the information is to register online. And if you have a friend or someone that you know, because you don't have access to a computer, you use your friends. The senior centers might also be a resource. Now, I know my senior center team members are going to shoot me, but they might be able to help you understand how to navigate it. So we'll get more information on how to navigate. But again, that increase, that lowering of the age to 65 did increase us by about 2,000 people. We don't necessarily schedule the appointments. You were registered, and then you have to, once you're registered, you'll get an email confirming your registration. It will be telling you to hold tight until you get contacted. Is that?
I think that's extremely important, and that'll keep some of the phone calls from, the follow-up phone calls that people are still really confused on. And as we get longer, it might be advantageous to send out some sort of we're working on it. We know you're registered, so that they don't start then calling. And I heard that there was a lot more calls than that. There was almost 1,000 calls a minute at the hospital at one point in time. So I think that'll be very helpful to know that that registration is coordinating with everybody.
Yes.
So you don't have to actually call Vaughn's. You don't have to call the hospital or the rural clinics. So that's really helpful. Thank you.
And for our public to also know that, and that is a good suggestion. We are planning on and providing those updates to the people who are registered. How frequently, I don't have that information right now. It could be every week, it could be every 2 weeks. Hopefully every week, if we can do that. But I do want to let the public know and take this opportunity to let the public know that please do not expect that you're going to be getting a call and signed up in the next week. It will take weeks to get through this first tier of phase 1B. So it is going to take a while. And once we're able to plan and execute more mass vaccine clinics, that will help us really penetrate our immunizations or vaccinations to our residents. But it will take us a while, and it will hinge on having a supply chain that we can reliably anticipate and schedule for. So.
If correct me if these numbers are wrong, but in the total 1B category, there's about 8,000 people in Inyo County, and we got 100 doses last week. So I know everybody's very anxious to get the vaccine, but and until we get the doses, it's going to take a while.
And the good news is we have people and residents who are wanting the vaccine. So I do believe that our percentage of people taking up the vaccine is going to be fairly high because, it is a good sign that people are seeing this as a way really to get us through this pandemic sooner than later.
I've got a question, and I'll have some other questions I'll save for later, but this one relates right to this. So I think I want to be able to assure at least people in the far reaches here in the 5th District that if they register, okay, then somehow that their name will then be connected with a location nearest to them for the vaccine, because I think so there's a lot of people in Lone Pine who don't use the rural health clinic as their provider. There's some that do, and there's many that don't, or Southern Inyo. But it will still, in other words, it will connect them with the right place, because that's what at least some people's fear is yeah, they're registering, but and then the scheduling for Southern Inyo for this health clinic is happening here locally, and so they want to be assured that their name is being put into that list. And,
right.
and I get it too. I mean, I think we need to make sure people know that it's going to be possible for somebody, you know, that you think is less deserving than you to get a vaccine possibly before you because of this registration process. It's not all going to just come out perfectly. So anyways, could you address that?
Yes, and yes, having people register, it associates, not only does it allow us to communicate back with updates to the extent that people have email addresses that they're putting in, but it does help us identify what parts of the county they're in, will help inform us for additional clinics as more vaccine becomes available. So I think we've talked in the past about the fact that at this point in time, with the vaccine that we have, we really want to focus on being as close as we can to a hospital, just in case there's some sort of allergic reaction. We want to make sure that we're not far away from more advanced medical assistance. So right now, primarily we're offering out a Bishop and Lone Pine. We hope that changes, and also there are additional vaccines coming out that may be a little bit easier for us to get out to the far-reaching locations. But for right now, as long as people are putting their information in, telling us where they live, to address that southern part of the county question, right now the vaccine would be available through Southern Inyo's Rural Health Clinic and Toyabe for certain populations that they're serving as well. The availability is very slim at this point, but Southern Inyo, for example, isn't restricting it to just people who are established patients. So we will get through those populations, but then also once we're able to start doing larger public health-led mass vaccination clinics, that will help us know what the anticipated volume is, help us in our planning so that we can get to those people and make sure they have the information about where to go.
I think that just a second, Rick. I think that's really reassuring that it'll go, you know, that they'll get on. I don't have people demanding that they get a vaccine tomorrow. They just want to know that they're getting put into a queue, sort of in the right place, and the message back is very helpful that registration has happened. So thanks for that. But this will be helpful to be able to at least say, no, you've registered with the county, but the provider might be Southern Inyo Hospital or Rural Health Clinic or somewhere else, but you're being put into the queue in the right place. Thanks.
And I think that's critical because, you know, we're looking at that as a constraint, and it is for some people to get from point A to point B. On the other hand, it's a real positive note that there are people, you know, coming to California from Oregon because they think there's a better chance of getting a vaccination. So, and I know there's some people like that. So I want to make sure that we keep these people in the queue, and, you know, we'll figure out a way to get them there. That's what I feel. I mean, but you don't want to stop it and say, well, we're going to have something out in the boondocks, maybe at some point in time.
Don't wait to get on the list.
No, don't wait to get on the list.
Yeah.
And I think a lot of people won't wait to come and get the shot when they're up in the queue. It will come, or we'll get them there.
Okay, before we go any further into the reports, Ms. Ellis tells me that there is 2 submitted comments that are related to the COVID-19 staff report that I'm going to have her read now, just in case there are questions in those that can be answered in people's reports.
Okay, we have a letter from Kathy Hesseman from Homewood Canyon. She says the state of California has people 65 and over at Tier 1, Level 1B. Vaccinating now, Inyo County has people 65 to 74 at Tier 1, Level 1C, not vaccinating now. Shouldn't the county be following the state's criteria for vaccinating?
I'll address that. We are in the process of having our website updated with we did put out a press release, but realized early this morning that the core information not been changed, and I just got a text confirming that it has been updated this morning.
Great. Is there another one, Darcy?
Yes, sir. This one is from Mark Robb. He says, the idea of prosecuting a church was never in my wildest dreams. But then again, the Democrats stole the election. The Clintons get to go scot-free, and Dr. Richardson gets to wield authoritarian power. Dr. Richardson would do well for himself to remember that the First Amendment of the United States Constitution supersedes the Health and Safety Code. The U.S. Constitution and the First Amendment, the right to assemble, and the freedom of religion supersedes the Penal Code, and the United States Constitution supersedes Dr. Richardson. He is not a judge, a member of the judicial branch of government, or a law enforcement officer. Thank you, and tell him to stay out of the affairs of those practicing their religion while exercising their First Amendment, much like I am exercising my free speech in this email.
Thank you. And I'll remind the public. Yeah, let me just tell people remind people that how to raise your hand if you have a question pertinent to this item. You click on the participants icon at the bottom of the screen, and then on the right hand of the screen, when the attendees pop up, you should be able to find the raise hand feature. Go ahead, Mr. Richardson, Dr. Richardson.
Yeah, I appreciate that comment, and I understand the concern. I don't wield the Office of Public Health Officer as a directive unilaterally. Most of our guidelines are coming down from the state, and we have to follow those. And sometimes we have to use public health orders to achieve those ends. This is all in the name of safety for the public. Public health in a pandemic often supersedes the desire for the public to do what they wish and what they believe are their rights. I agree with a lot of what you say. This is very difficult times in trying to keep especially the religious part of this community safe from illness and progression of disease. It's a difficult situation, and I understand your concern, but I have a job to do to protect the community. And this is not done unilaterally. This is done in consultation with our attorney for the county. Many of the planning and decision makers in our department get involved before the decision comes down to making a public health order. So it's a difficult situation, and you have to bear with us. We're doing our best because of the record number of cases across the country, the death rate, and our record number of cases. It's something that we just have to deal with.
Okay, thank you. Is there anything else from staff on COVID-19?
I've got just a couple of questions if the presentation is done. Can you remind us what we would, what our rate, or like what our daily rate would have to be to, and I guess it'd be for a couple of weeks, to make it so we came out in red instead of purple?
So that, let me just make sure I understand it. When the regional stay-at-home order occurs, what would have to occur in order for us to not come out in purple?
Well, let's say the regional stay-at-home order stays in place for another month, and our rates, you know, what would they have to do to get in line so that when the regional stay-at-home order leaves, we come out in red instead of purple? I should know this, but it's been a while. So.
Well, it has been a while, and I'm hoping Anna's looking it up, because we have to have 3 weeks in a row.
Okay, 3 weeks.
At a minimum of being of having metrics that are in the red or lower.
Right.
But we would not necessarily come, you know, if we were in yellow, we wouldn't necessarily just jump into yellow, but we would have to be 3 weeks in a row at metrics consistent with the red tier, which, Anna, do you have that readily accessible?
Yeah, so the to be in red, we'd have to have a daily case rate of between 4 and 7 per 100,000. So we've been there before. We're not anywhere near there right now. I think our case rates, let me just pull up. This is our case rate per 100,000 per day. This is a 7-day average with a 7-day lag is at 89 cases. So that's the 7-day average. We're well above the criteria to meet red. We've got to really significantly decrease the number of cases.
Well, so I know we are. I'm just trying to remember what the actual and how many cases, not necessarily per 100,000, how many we'd have to have average out on a daily here. That it seemed like it was like
it's approximately between at a maximum about 1.5 a day.
Okay, that's all I need to.
Right, but didn't we have the rural county metric, the small county metric that was different than the per 100,000 metric?
Yeah, they're still looking at case rate, but so if we're in a tier, still measured by our case rate, but to move out of it to go to a more restrictive tier, there's a buffer. So there's a small county number. I know to move between orange and red, it would allow us to have up to 14 cases, absolute number of cases for that week, even if that put us over the case rate. So once we're in a tier, it buffers us a little bit. That buffer's a little bit larger to go from a red to a purple tier. I want to say, I'm sorry, this is off the top of my head. I want to say it was more like 28 cases, somewhere around there. So that gave us a little cushion before we actually got moved, so that if we our percentages kind of went up and down, we wouldn't be back and forth a lot. But as far as getting designated for a tier, as we come out of a stay-at-home order, it will be based on that case rate and test positivity rate.
That's good. I just want to be able to talk about that if I need to. How we could. I mean, of course, we just want to get out of the stay-at-home order, but it'd be nice to get as much, come out in the best color that we could. I think you answered my question about how often we get vaccine. It comes weekly, but it's not necessarily, we don't know exactly what we're always going to get, it sounds like.
Yes, we get a weekly allocation. It has been different just about every week so far. So we also have been given over the last couple of weeks the opportunity to request additional vaccines. So we requested an additional 1,000 doses for this week and have not heard yet if basically if there's someone who's not going to be able to use their allocation and doesn't take it all, then it'll be redistributed. We have not received any confirmation that there will be a redistribution so far this week.
Okay, great. And last is just on the mass clinics. I think you basically answered that, is that the hope is that we'll get to where we don't have to be at a medical facility. And would you anticipate then that you'd have like EMTs or ambulance or, something like that in place of being at a medical facility available, or how that would work. I really hope we get that. That's going to make it, well, when we get enough vaccine and then we can actually get out and into the various locations, I think that's going to really start to turn the thing around, which we already are, I know.
Yes. Bottom line is, yes, we would hope to have either an ambulance standing by or have additional medical personnel. The issue is that if someone needs, if someone needs a little bit more advanced medical response, and we're still very, very far from a hospital, that's putting, I mean, that is what it is in a lot of, it's going to be a long ambulance ride. But yes, we would have additional either an ambulance standing by or at least have some EMT or other medic staff assisting.
Great. And lastly, for what's happening for me, I think one of my most common complaints that I get is that Inyo County is somehow picking to enforce rules differently than other counties. And it drives me crazy because people say, oh, well, this is happening in San Bernardino or Kern County or whatever. And just for the public, I'll just say, I think that we don't have the capacity to over enforce, that's for sure. We're trying to enforce on a complaint-based basis, but other counties are probably having the same issues with trying to enforce. I mean, I would guess. And I think about San Bernardino County in particular. Oh my gosh, that county is humongous. And the fact that you might see something in San Bernardino County that you don't think meets the stay-at-home guidelines is not really that surprising. I mean, so anyways, I think it's just important that people understand that they're going to see some of this, and it doesn't mean that Inyo County is over enforcing or under enforcing. I think we're trying to do the best we can, but anyways, I'll leave it at that.
Well, I have just one thing, and I know you probably thought about it, but there are medical personnel who are retired and who may not be willing to come into, the active part of the COVID thing. But, I think Northern Inyo, I've talked to Northern Inyo about this, and I know that there are some retired medical people who might be qualified to do exactly what you're saying. And that is to just be on standby in a vaccination, assuming we had a lot of vaccines that might be willing to be on standby just in case. The chances of that happening I think are slim. At least Dr. Richardson and other doctors that I've talked to are the chance of a serious reaction are very slim. But just to have somebody there, they might be able to pull people out of retirement to do that. And I think that would be a good thought anyway.
Absolutely. And in fact, we have started to bring volunteer retired nursing staff on and have had a couple already helping us with our clinics at Public Health, have several more waiting in the wings. We're moving through we do have a disaster healthcare volunteer system that we're utilizing. I'm bringing some additional staff in to be able to, so I have more ability to utilize that system, but that allows us to check people's licenses, make sure that the licenses are valid, and then allows us to deploy through that system as well. So we are building out, that's a system we use for disaster response when we need to, but we are building our capacity to be able to get people in, registered, and actually deployed through that system. So especially once we get to much larger vaccine clinics, we can pull some of those volunteers in to assist, either licensed volunteers to either administer the shots or monitor for reaction, but also non-licensed staff to just be able to help with general flow or registration and things like this.
Thank you.
We do have, Dan, I got some comments from the public if we could take first, and then we'll get to your question. I see there were two, now I only see one. There's a Shaylan Cuff. If you have a comment, please unmute yourself and go ahead.
Hi, yeah, good morning. Thanks for hearing me. I've been listening in this morning, and it doesn't sound like the vaccine is going to get to the masses anytime soon. And I'm just wondering if we could think of some other proactive measures like prophylactics, or if there's any local place we can get tested to see for people that think they may have already had COVID. Maybe they could find out if they got the antibodies. Just wondering if there's some positive other things we can consider. Thanks.
Oh, I do know that if you donate blood, they give you a free and automatic test on whether or not you have the antibodies.
Okay, is there a blood drive coming up soon?
I'm not sure when the next one is scheduled for.
Okay.
Sorry about that.
Great.
But the prophylactics like ivermectin or something that people could take, maybe especially people in the care center, or I don't know, maybe they've already got their vaccines.
Yes, ivermectin has not been shown to be effective yet. They're running studies right now, so there's no recommendations for it or against it.
Mm-hmm.
There's another drug out called Luvox, which is a SSRI, selective serotonin reuptake inhibitor, that is an antidepressant. They're studying to see if that mitigates a lot of the progression of the disease, and there was a small study that suggests that it does. But right now, there is no prophylaxis other than a vaccine that's available.
Okay. I had heard Kroger's their pharmacy was doing testing for the antibodies. I wonder if anybody could look into Vaughn's, or see if that's something they might be interested in offering to small communities that are going to be slow getting the vaccine.
Well, there's a lot of drawbacks to the serology. One of the antibodies that tests for prior infection, which is called IgG, sometimes wanes over 2 to 3 months. So you don't get an accurate analysis of really if they've had the disease. There's 3 ways you get active immunity, and the IgG antibody is the one that's easy to measure, but unfortunately it's not entirely accurate. If it is positive, that does give you information, but if it's negative, you don't really know if you've had the disease or not for sure.
Okay, well, thanks for your time. I'm just hoping we can be proactive, looking, and not just waiting on, a vaccine that seems so long in coming.
Okay, thank you.
Yes,
thank you so much, Ms. Kloss.
Go ahead.
If you have something else to add, Dr. Richardson, go ahead.
No, I appreciate what she's getting at. I think we think of these, at least I do. I study these options all the time, look for the latest results on current treatments prophylactically and for use for mild disease to prevent progression, but nothing has really been confirmed yet. That's one of the problems. This disease, this novel coronavirus, is so new, and we've had trouble getting a handle on all of the idiosyncrasies of this virus.
Okay, I appreciate it. Thanks a lot.
Thank you, Ms. Kloss. And if we could go to Declan next, if that's possible, just because that person had their hand up earlier. If you're unmuted, you can go ahead and give us your comment.
Awesome. How you guys doing? Thank you. So I know it was mentioned earlier that the number of healthcare workers specifically accepting the vaccine was very high. Do we have any data on publicly available data on what that figure is and how high?
I don't know of any.
What?
Do you know, Anna?
Yeah, what I have is anecdotal as reported through our local hospitals, and we think we're approaching 70% the problem from a public health perspective is we don't get a report on declinations or people who've declined the vaccine. We get how many have been administered. So some are still awaiting their chance to get first dose. We're still working through some of those healthcare providers that may have declined very early on and are now interested in getting that vaccine. So again, anecdotally, we think we're approaching 70%, but don't have the straight data to from those total number of healthcare providers versus who's declined.
Awesome, thank you.
Thank you. Next, we will go to Dan. There's still another comment or two. I see Lynn Greer has her hand up.
Can you hear me?
Yep. Good morning, Lynn.
Hi, good morning. Well, I'm just kind of wondering how many of you have been in contact with a lot of the community members that are not able to operate their businesses right now. It seems to me that they are not getting a lot of information update. I know that sometimes it's easy to get caught up in the county bubble because you guys are so bombarded right now with everything too. But as I talk to some of these community members that aren't allowed to operate their business, and obviously there's tons and tons of commerce going on around them, I'm just wondering if there's anything a community member like myself can do to help these people outside of giving them money. They don't want to be told to hang on. They don't want to be told good luck. They don't want to borrow any more money. They're just on the verge of economic collapse completely. And so as I'm listening to this rollout, it seems to me, and this is no, I don't mean any disrespect to any of the county employees, because I know everybody's trying to do their job. And that's what these community members are too. They just want to do their job. They want to provide for their families. They want to be able to provide for their employees. It's a huge issue. And I know you're hearing a lot from people that want to stay in lockdown, to stay safe and everything. And I'm just going to have to assume that those people are not doing without some sort of income, either from retiring or they have a government job and they're allowed to stay home and work. And so it's just really, I cannot get the look of distress of these people's faces out of my head. It just haunts me. And I just really want to do something other than wait for Gavin Newsom, that might be waiting for Biden to do another rollout, which is more borrowed money. So just as a community member, it doesn't seem like you have any information. A lot of the community members don't even know who you people are. It seems like it's us against them. If I support a community person in helping them keep open, then somehow I'm a horrible COVID person, and I'm not. I just want to see people to be able to go to work safely. A lot of these people have spent thousands of dollars retrofitting their businesses 3 and 4 times. And you can watch the commerce going on down in Main Street, but some of my friends can't have one person at a time giving a haircut, or it's so ridiculous. This whole thing is just a government mess. You guys are basically admitting that on this Zoom meeting today. So I would just like to know if you're talking to your community members, and as community members, who do we write to? I mean, I don't want to make anybody mad. I don't want to disrespect anybody's job, but we're being told to wait, and the waiting is over. It's almost been a year. And I just know what it's like to run a business and have that pressure and not be a government worker who's going to get a job or get a paycheck, whether you show up or whatever you're doing. So if you have any answers to that, I would love that. And maybe you guys can, I know you talk about online and you get these press releases out there, but somehow the information isn't getting there. A lot of people can't show up to a Zoom meeting at 10 o'clock on Tuesday morning. So somehow there's a huge disconnect And I don't want warring in my community because you don't support COVID or you do or whatever. I just want the people in my community to be able to provide for their families without going in debt. Anybody?
Yeah, thank you, Lynn, for the comment. And, you know, there is no easy answer to this that I know of. One of the things that I've been I have, friends and community members, who have told me a lot of heartbreaking stories, and I wish I had a great answer. One of the things that I've been advocating as strongly as I can with the state and with the feds is that, at this point is when these businesses and their employees need the support. And it just hasn't come through. There's, hopeful signs, coming from the state, and, who knows what's going to happen with the federal government, but the latest budget proposals have had some big business relief in them. It's been one of the biggest disappointments of this entire thing for me.
So is there anything that I can do? I mean, is there anything I can write to? Like I said, I don't want to make anybody mad. I don't want to, but I want to help my people in my community. Like I said, I cannot get the looks of their faces and they're distraught out of my head because I'm a business owner. I know what that's like. And yeah, I'm open, but no one else is. So I'm losing money too.
I see Leslie has come up. Leslie, do you have some comments on this?
Other than, writing the state, we are following state guidelines. And so, my recommendation would write the state legislatures or try to talk to them and let them know what your thoughts are. But from a local standpoint, there's a few ways that you can get information and that we try to distribute information. And one of them is through email list. So if you go online and you sign up, I think there's 3 different places you can sign up under COVID-19 or reopening local businesses. And whenever there's a press release that goes out, anyone who is on those lists gets email notification. And so we try to get the most up-to-date stuff out that way. Also, if we have something going on that impacts a certain business sector, then we'll send it out, whether it's short-term lodging, restaurants, grocery stores. So we try to send out sort of industry specific to the different industry people. I don't think that we have everybody on our email list, but if you go onto the website and you sign up, then you can get on those email lists. And I think that's a good way to get the information, because I know what you're talking about. A lot of people don't listen to radio anymore. And, if you're not reading the newspaper regularly or listening to the radio, sometimes it's hard to get that information. So that's all I have, unless there's a specific question.
And we also, on the county's YouTube channel, have videos of the grant workshops. Some of those may be helpful. Jennifer, it looked like you were about to talk.
Yeah, thank you, Mr. Chair. I just wanted to maybe address Lynn directly. I hear you, Lynn. One of the hardest things about all this has been almost the neighbor against neighbor situation that's come about almost after a year of everyone having to take one side or another. So,
yeah,
obviously I don't have any solid answers, but I do have 2 thoughts in direct response to what you mentioned. One is our state senator, Senator Borges, has introduced legislation, and I've talked to some of his staff members. They're extremely responsive, and that legislation is now moving quickly because it's not just bipartisan, it's nonpartisan, in his words. And that's for more bailouts for businesses. But I hear you, there's no amount of bailout that can replace commerce, true commerce. And but at least I feel with Senator Borges, he is responsive and in fact, very much in consideration of exactly what you're saying. The second thing I would say is, in my mind, public health is so much more than what we've tasked our public health and health and human services departments to deal with. And I know for a fact, and I bet you do too, that there's a number of communities, organizations throughout the Inyo County, the Eastern Sierra, Bishop, and all throughout. I'm just going to mention the ones that I know about, and that would be the faith-based community. I feel that from the get-go, they've been involved in helping our neighbors, particularly the ones that have been singled out by this, maybe people who work in restaurants, people who work in salons, people who work in hotels, some of those businesses hardest hit. I know of grocery deliveries. I know of collections being taken up in churches that have been given to families directly hardest hit. I know there's so much going on in that realm that maybe is outside of the public arena, but in fact, I think it almost is far better thought of as a partnership, I hope, going forward. And that's where I'm kind of trying to focus my, what can I do for my community thoughts and outreach. So I don't know if that helps, but it's something I've been thinking a lot about.
Thank you.
Well, I think I know that this county has, we spent a lot of time talking about, the public safety, which is absolutely important. But I think all of us understand how critical it is to keep the economy going. And, sometimes we're at odds in those two protection things that we're trying to do. And I totally empathize. And Lynn, I do talk to people every day, business owners, try to give them the advice that we can give them. And I know this county hasn't forgotten that. I mean, Leslie Chapman has done an unbelievable job, and the county, the group, and their focus is on the economy, because there's two ways to destroy a local economy. Obviously, one would be everybody dies of a disease. The other is to have no economic basis when you get back. And so we're, I know all of us are well aware of that, and we're working with the feds and the states to try to come up to some sort of a conclusion, but they're as confused as we are. And it's a little easier for them to come up with an idea and then say that it's the local entities that have to implement it. And that's what we're trying to do now. And we have not forgotten the economy at all. I know it doesn't seem like there's as much effort put in, but there is. We're doing everything we can do to protect our local businesses.
Okay, thank you. Dan, you've been waiting patiently.
How do you, that's an assumption. I've been waiting. I'd like to go back to our very early public comment and a few of the comments that we've received on this topic. I believe our mission as a group of county supervisors is to find the right balance between competing interests. Public health is one of those extremely important issues. Obviously, the economics are important. And for me, listening to experts, listening to fact is the important part. I appreciate what Dr. Richardson and the HHS people have given us. They've looked into these things. They understand what's real, what isn't, and they've given us good information to be able to make those balanced decisions from. And no matter what we do, somebody's going to get hurt. And in this situation, I'm not sure how many people get helped, and I want to be sensitive to the businesses. Without businesses, we aren't in existence. I also want to be sensitive to the close to 1,000 people who have now gotten the virus in this county, and 29 who are no longer in existence from it. And maybe almost as bad as the 29 are the people who can no longer do the things they used to do because they have problems with circulation, blood circulation in their brain, or lung problems, or whatever else. But I appreciate what Dr. Richardson has done for us, because I trust his knowledge, his expertise, and his desire to also try to balance, but look at public safety.
Okay, thank you. We have one more hand raised. That is Mr. Nicholson. Please go ahead, sir.
Thank you again, Chairman, for allowing me to speak to you. And just want to say I appreciate the opportunity for conversation back and forth, whether or not we're in agreement on things. And just real quick, Supervisor Kingsley, I definitely understand that my opinion is just that, and I'm not trying to force that on anyone, but a lot of this stuff is subjective and up to for interpretation. I do address the board today with a heavy heart and surprise that the county would address churches and discourage indoor religious services, believing that, and I quote here, attending an indoor religious service is an extremely dangerous activity for anyone to engage in right now. And again, this is subjective because it's not extremely dangerous for me and my family. And that being the same for a lot of others who choose to exercise their First Amendment. If lockdowns and masks and stay-at-home orders were effective, then we probably wouldn't be in this mess. And the orders from Governor Newsom, he clearly doesn't believe that either because he doesn't follow his own orders. And I agree with Dr. Richardson when he's talking about safety for the public. I just think that we may go about that differently. For me personally, I want to enforce with my family, friends about preventative health, that being spiritual, mental, and physical health, good nutrition and fitness. And I just haven't heard that discussion during these portions of our board meetings, but I also have not been on every single minute of every board meeting. I'm not saying that's not happening. And so I would end my statement with the same question I posed to you when we spoke about short-term rentals. What data is there connecting religious services to an increase in COVID numbers?
Okay, thank you for your comment. Is there any response to that from staff or any comments or questions?
No, I can speak to that somewhat. One of the problems with our escalating record number of cases is based on, in many ways, this pandemic fatigue that is spread across the country. And that's based on just the conversation today between the public and us. You can see that there is a frustration, and early on when this pandemic broke out, everybody was on board with all the recommendations and they stayed home. You don't see that anymore on this shutdown. People tend to, they're tired and upset with everything that's happening, and we've had people voice that today, and it's very understanding. I am the same way. I am upset terribly about the businesses that have to close down. My personal feeling is somehow that has to be looked at, and we should lobby the state to see if we can pick and choose instead of a blanket policy just for everybody in our county. But in terms of the indoor activities, such as indoor services at churches, it's well known that if you gather people together, the virus sometimes lingers in the air for minutes to hours. And if you don't wear a mask in the service, or if you're there just as a person that is attending the mass or service, the droplets hang around for quite a while. And that's just an added source of infection. And that's one of the reasons why we have many of these increased cases, is people are just not following the rules. When I say rules, these are public health standards to prevent the transmission of disease. It's real simple. If you stay at home, and many of our 75-year-olds and above do stay at home. I have many patients in that category, and you don't see many cases that into 75 years and older. And that's because they are afraid of getting disease. But the younger people and many of the middle-aged, they figure they can survive disease. And they're wrong, because many of those young people suffer disease that is debilitating and long-term, and even death. So I think people need to take this seriously. If you look across the country, we're at record numbers. The one-day numbers for deaths, we've surpassed it nationally. So I don't think we can take this disease lightly. If we do, we're going to have tremendous amount of deaths. They're talking about 30,000 more deaths that are predicted through the month of February. So the pandemic fatigue is a major problem, and that is gatherings, not masking, and just being out in the public and communicating with other people is a way to catch the disease. You got to be distancing.
Okay, thank you, Dr. Richardson. Is there any other comment? I guess I would just make one analogy. This summer was really high fire danger, and the BLM and the Forest Service banned fires, and yet there were still fires. So if you use that logic, then banning fires is counterproductive to having forest fires. So my point being that we still have tremendous spread throughout this county and throughout the entire country. And, you know, I think it's still something that we need to take seriously, and we try to balance all of these other competing issues. So anyways.
I'll make one last comment. We have 85 people on this call. And I am thrilled to have this kind of public engagement. And I get it that the pandemic is not a good thing, but Zoom is. And we are being able to talk with people from across our county in a much better way. And you know, Josh, I hope you didn't take that I didn't think your opinion was important. I do think it is. I just wanted to point out that I get input from a lot of different places. But having these kind of conversations is healthy, and I really do appreciate that we get to do it, that we're getting to do it this way. I mean, it'd be tough to have 85 people in our boardroom. So it's great.
Okay, I'm sorry. We have one more hand raised. And Rick Klug, good friend of mine. Go ahead, sir.
Thank you very much, Chairman and Council. I've been listening and actually meeting with other pastors as we thought and prayed through all this. And there's just a couple things. I'll try to be concise. First of all, we are taking the virus seriously. We do know that the public health is huge. We need to care as much about the mental and emotional health as for the physical health. Now, it's tied to the economic health, but my mom lives in a retirement village. They've had a number of people die not related to COVID. Basically, I mean, again, it's anecdotal, but due to lack of human contact. People can't come into their rooms as much. These 75-year-olds, I'm talking to my members on the phone, and their emotional levels going down, and that's when they get more sick. I will say, again, anecdotally, the churches that I've interacted with, we have paid attention as much as possible. There's been no cases that we could connect. And I know that the contact tracing goes forward, not backwards. But the people in my church who have contracted it haven't been in our church, haven't been there. I met with a man who had lost his wife. He'd been isolating. He'd been having a hard time, just emotionally down. And a few days later, found out he had COVID. And so I went into quarantine. I waited 6 days or something like that, got tested, stayed in quarantine, came out negative, thankfully. I think his emotional state lowered him. I just think we need to keep that in mind. The narrative that the reason we have this spike is because people are not following the shutdown rules, I challenge. I think some of that is false. We need to know that we got to get the businesses who prove that they can operate safely the freedom to do that, because frankly, regardless of the state rules, I think we just let them operate, because that lifts the community. And again, I agree with Jen Roser. This is about partnership. This is about let's work together. We have complied. We were wearing masks. I actually preached on video because I was still quarantining, even though my test was negative. We're trying to work with the county, just as the county hopefully is trying to work with us, not sending threat letters, but let's sit down and talk about the real science and the different opinions and lift everybody up together. And I would say the answer is not a government bailout. It's not state, federal government give us more money. It's how do we do it well, like we were in the purple. And I just want to end with saying thank you for your responses. Thank you for your transparency. We have differences of opinion, but we are working together for the best of this community. And I look forward to meeting with more of you later. So thank you.
Thank you, Pastor Klug. Okay, we will move on in our agenda.
Mr. Chair.
Oh, yes, ma'am.
I'm sorry. I didn't know if there were more speakers, but I did want to follow up on some of the things I've heard, if you don't mind. I'm hearing a lot just from some of the frustration in the public comment, as well as some of the very forthright conversation that we're at a crucible moment. We're at a time where we can either go at each other or we can come together in our communities. And I just want to build on that. You know, if you'll allow me a few moments, I want to say as a member of the public, one of my favorite pastimes was political conversation where you got to make fun of politicians. Sorry. But anyway, I love public dynamics where you have political arguments. And I just want to say to my fellow board members, I think even though I was a civilian outside looking in and had plenty of criticism for all of you over the last 10 months, I still think it's warranted to say that you have all conducted yourself in a manner that is worthy of respect. I appreciate what you've done over the last 10 months as leaders. I have to believe when you ran for office, you never thought you would be going through this kind of a situation. In fact, after the primary election and all this happened about midsummer, I thought about calling my good friend, Mr. Don Bright, and saying, I'm out, you can have it. This is an interesting time to be in public office, to be sure. So kudos to my fellow board members. I also want to say to our county staff, as I have learned to navigate this county, I've learned how, and I'm going to use the word of the century or the word of the decade, pivot, how Health and Human Services and how county administration and all the numerous administrative departments have pivoted to meet the needs of our community and meet the needs of our citizens has been inspiring. And I have to believe that if you went into public health, your goal was to meet the needs of children or meet the needs of the poor or meet the needs of various people, not to navigate through rolling out vaccines in some sort of record type of situation or dealing with a pandemic. So kudos to all of you. I will just say one of the things I've learned, and I've done a lot of research, and I'm going to be anecdotal if you'll indulge me for a moment, but I don't know how many people know. About 25 years ago, my husband was diagnosed with a genetic kidney disease, which led ultimately to kidney failure. Miraculously, Toyabe Dialysis Center was built about the same time as his kidneys failed. And then 3 years later, we were able to get him a transplant. So as a transplant patient with a suppressed immune system, he is in one of those populations that would be vulnerable. And so I took the time when all that occurred, and I still miss Dr. Kamei. He was tremendous in helping me through this, but I took the time to travel around this state and around this country and talk to experts in immunology and talk to people about health and talk to people about whole health. And Lee and I took responsibility for his health from that time forward. And I was one of those strange people that rode on airplanes with masks because I wanted to protect my husband. I was one of those people that sanitized everywhere I went. I sprayed things, I wiped things down because I took a great deal of personal responsibility for our health, something Mr. Nicholson alluded to. I think it's incredibly important for us to consider that. I just want to say that I know the county public health has had to respond to situations and complaints, and I think you've done that with professionalism, but I do think it's imperative that we understand personal responsibility is a big piece of health. And like Pastor Rick said, I believe that there's a whole lot more to health than just immunology and infectious disease. And so that's got to be key. I find that I had the opportunity, and I want to bring this up now as a possible solution. I had the opportunity to speak to county council, and I had some tremendous insights in regards to the legal tension we find ourselves in, the legal situation that the county is a sub-jurisdiction of the state, but also the tension between public health orders and constitutional rights. And the fact of the matter is there is quite a tension right now. And I think it's imperative that we understand that those constitutional rights stand on a foundation greater than anything, anything we can do, greater than anything the state can do. Those constitutional rights have to be at our forefront. And so I would suggest, kind of, I alluded to this earlier, that the legal framework and understanding I was given by county council needs to be shared with our area faith-based community. Nothing is more important right now. When I talk to members of our community, yes, like Supervisor Tothero said, there are people that have lost good health for the rest of their lives, that survived the disease and they've lost good health. But there are people that are suffering tremendously. There are people who are unable to buy groceries and churches have stepped in to deliver groceries. There are people who have lost their business. There are people that are suffering mental health. There are people that are suffering isolationism. And the stories go on and on and on. And I'm going to ask if going forward, and I thank you for indulging me on this, if going forward, if our public health, those of us who are leaders as elected leaders, and our county council can work together with our area churches, I would like to propose that, first of all, the leaders of our area churches in Inyo County meet with our county council and perhaps a member of our public health department. Because right now, like Dr. Richardson alluded to, people are in fatigue. And as Lynn Greer mentioned, people are really entering a state of no return mentally, with emotional issues regarding the failures of their business. There's few things non-physical that are as damaging as losing your business and watching it decline. And it's time for, I would like the area pastors to hear what I heard in terms of explanation of the legal situation we're in right now and the federal and state cases that are coming down. We are literally on the cusp of some decisions that could change everything for faith-based communities that can then partner fully and wholly with our health department to provide community health. I just want to encourage that, and perhaps if there's any pastors listening on the phone or on the meeting, if I can help arrange a meeting with our county council, they have offered, and I would like to encourage Dr. Richardson or his designee to participate in that as well, because we have to navigate this public health, not just immunology, not just infectious disease, but the whole picture. So I know where I stand, and I just want to put that forward. I stand on a firm foundation of the Constitution, and I want to make sure that that is never, never, never overlooked. That is a very firm foundation to stand on. So I want to just throw that out there and invite comment if possible. Thank you.
Thank you, Supervisor Rozier. I think that's a very productive and thoughtful way to move forward. So I appreciate that. It is approaching 11:45. Are there any comments on this matter?
I certainly support that idea, and I would encourage Supervisor Rozier to push forward with that and include. I'll make sure that churches here in Lone Pine are able to be included in the discussion as they would like, or as they're available.
Okay, thank you so much, everyone. All right, we will move on quickly to the consent agenda.
Mr. Chair,
yes,
can I just quickly make an announcement about the Community Resiliency Grant?
Yeah, you told me about that, Leslie, but I forgot. Sorry.
That's okay, no worries. I know it's already been a long morning, so I'll make this quick, but I just want to make sure that all of our nonprofit agencies out there are aware that we are in the application period for the Community Resiliency Grant Program for nonprofits. So it's open, the application and the grant guidelines are on our website. The application period is open until January 29th. And so please, everyone, I know that there's lots of nonprofits in need out there, and I hope to see your applications. Thank you.
Thank you so much, Leslie.